So, good day everyone. Today we'll be discussing about multiple pregnancy. My name is Añonuevo and my partner is Decenilla Jennifer. So, first of all, let us define what is multiple pregnancy. Multiple pregnancy is considered as complications of pregnancy because the woman's body must admit to the effects of more than one fetus. In this instance, a mother is conceiving more than one child or two or more children. For the etiology, we have the natural multiple pregnancy. So in the natural multiple pregnancy, it may either be due to the division of single fertilized ova into two or fertilization of two ovum. In this case, no other methods or medications are being intaken by the mother or being take place by the mother to conceive multiple children. For the assisted or reproductive therapy, we have the incidence of multiple pregnancy, which is significantly increased due to the use of the in vitro fertilization. So in this type of therapies, so the conception of the multiple pregnancy is from the taking of the ovum and the spermatozoa samples into a laboratory dish to use it for the fertilization and then for the conception of the multiple pregnancy. We have the administration or intake of ovulation or ovulation stimulating medicines. For example, we have the clomiphene citrate and the follicle stimulating hormone or FSH. The intake of this kind of medications induces the production or increase in the production of egg cells, and in other cases, it induces the multiple pregnancy once that there are multiple ovum that are being fertilized. So for the risk factors of the multiple pregnancy, we have the increase of maternal age. For example, we have the 30 to 35 years of age. Next, we have the increasing parity. For example, we have 5 gravity onwards. Nutritional factors, pituitary gonadotrophin. For the pituitary gonadotrophin, there is a research in Nigeria in which they have concluded that the higher the FSH levels that are found in the mother of twins, it just supports the idea or view that higher production of pituitary gonadotrophin results to higher incidences of conception of multiple pregnancy or having twins. And then next we have the assisted or reproductive therapy. So as we have mentioned, an example would be the in vitro fertilization. Next we have the race. For the race, we have an example in which the blacks and the Hispanics are more common in conceiving multiple pregnancy than that of the Caucasian races. So for the next one, we have the modifiable factors of multiple pregnancy. We have the cigarette smoking, substance abuse, anemia in which the hemoglobin goes lower than the amount of 10 gram per deciliter, and then bacteriuria or urinary tract infections and genital infections. The non-modifiable factors of multiple pregnancy includes the increasing parity, then the age of the mother, for example, 18 or less than 18 years old and more than 30 years old to 40 years old, the race, low pre-pregnancy weight, poor nutrition, cervical injury or anomaly, uterine anomaly, and over-distended uterus that may be due to the multiple pregnancies before and polyhydramnios. For the types of multiple pregnancy, we have fraternal or non-identical twins, and then we have identical twins. For the fraternal twins, this is the instances wherein there are two ovums that are being fertilized by two separate spermatozoa. So the spermatozoa may came from the same sexual partner or in some instances from different spouse or from different sexual partners. Then we have identical twins. Identical twins are formed from the fertilization of a single ova that is being divided into two identical identities. So here we have further discussion of the identical and the non-identical twins. The identical twins, so the conception of the identical twins came from first a single ovum that is being divided into two identical identities through the fusion process or through one of the first cell divisions on fertilization. And then the sexes of the identical twins are always the same. And some of the characteristics of the identical twins would be having one placenta, one chorion, two amnions, and two umbilical cords. On the other hand, we have the multiple pregnancy or the non-identical pregnancy, in which fertilization process when two ovums are being fertilized by two separate spermatozoa that may came from the same or different sexual partners. And in this case, the sexes of the fraternal twins may either be the same or different from each other. And some of the characteristics of the double ova twins are the having of the two placentas, two chorions, two amnions, and two umbilical cords. Next, we have the manifestation or the signs or symptoms of conceiving multiple pregnancy. So, it is suspected in early pregnancy stages that multiple pregnancy has been conceived due to the increase or the fast increase in size of the uterus in comparison of normal pregnancy. Next would be the elevation of AFP levels, a different flurries of action of different portions of the abdomen instead of being located into only one or a common place on the abdomen. And then we have the multiple sets of fetal heart sounds.
Next is nursing management. For the independent function, encourage mother to take high levels of protein and carbohydrates as well as iron and folic acid supplements. So a woman with multiple pregnancy needs to gain more weight than a woman carrying a single child because of the increase of fetal weight. So she must intake the following nutrients. Next, advise mother the needs of frequent prenatal supervision. So this type of pregnancy is very dangerous and at risk for complication. So it should be monitored more closely to either detect early complications and advise for nutritional needs of the mother. Then provide emotional support. So due to parental role changing of the mother or deal with fear concerning mother and child's risk for multiple pregnancy. Next, assess women's hematocrit level and blood pressure closely during labor or while waiting for cesarean arrangement. Anemia and gestational hypertension occurs higher than the usual incidence, so we must monitor the hematocrit level and BP to a woman with multiple pregnancy. Next, support mother's breathing exercise. It is to minimize the needs for analgesia or anesthesia during labor. Also to minimize any respiratory difficulties of the infant may have because of immaturity. Next, monitor FHR using Doppler. So it is for fetal monitoring and it should have two separate beats that can be heard to know that each infant is doing well. Next is assess the women in the immediate postpartal period. It is to monitor postpartal hemorrhage. Next, promote the needs of extra rest, especially in side-lying position during the day. It is to increase the placental perfusion and prevent preterm labor. And for dependent function, administer sublingual nitroglycerin as prescribed by the physician. It is to relax the uterus and make external version possible. So if version is not successful, a decision of breech birth or cesarean birth must be made. Nursing diagnosis. fatigue related to increased stress and body functioning secondary to multiple gestation, then parental role conflict related to recent discovery of multiple pregnancy, then fear concerning her own and the baby's health related to risk of multiple pregnancy. Medical management for laboratory or diagnostic procedure. So we have three. First is the alpha fetoprotein screening or the AFP. It is a blood test that measures the level of alpha fetoprotein during pregnancy. This protein released by the fetal liver and found in the mother's blood. So one indicative of abnormal AFP is the detection of more than one fetus making the protein. So if the AFP level is high, it indicates more than one fetus making the protein. So next is the pregnancy blood testing. The level of human chorionic gonadotropin or the HCG may be quite high with multiple pregnancy. Next is the ultrasound. It is an imaging test that uses high-frequency sound wave to identify the gestational age of the fetus, assess the number of fetus in a pregnancy, evaluate the placental structure, location, blood flow, and allows physical examination of the fetus. So it is also helpful in detecting the fetus condition and probable complications, just like in multiple pregnancy. So ultrasound can reveal multiple amniotic sac early in ultrasound examinations, but in some instances, in as many as 30% of the women, only one fetus remain. So it is called as vanishing twin syndrome. And for medication, first we have sublingual nitroglycerin. So again, it is to relax the uterus and make external version possible. Next is the tocolytic medication like nifedipine or magnesium sulfate. It may be given in preterm labor to slow down or stop the contraction. Next is the corticosteroid medication such as the betamethasone. It is used in preterm birth and with multiple pregnancy for the fetal lung maturity and prevent fetal death. Complications of multiple pregnancy. So we have preeclampsia, it is more common, 40% in twin pregnancy and 60% in triplets. Next is gestational diabetes, postpartum hemorrhage, placenta previa, preterm labor, anemia. So due to hemorrhage, it may cause iron deficiency and anemia. Next, miscarriage and cesarean delivery. And for fetus complication, we have a neonatal death, preterm delivery, growth restriction, single fetal death in twin pregnancy, high risk of congenital anomalies, then filamentous cord insertion. So, the cord inserted in the fetal membrane. Next is the twin-to-twin transfusion syndrome. So, it occurs in monozygotic twins wherein they share common vascular communications which can lead to overgrowth of the one fetus and undergrowth of the second.